Well, I'll just say my name is Todd Dykstra. I'm a physician assistant, and I work at the community care office here in Guilderland. And basically, I see patients all day long, newborns to nursing home, and it's mainly sick visits. Occasionally, we do see like a physical or maybe a chronic care follow-up for the doctors. But mainly, my role here is for urgent care kinds of things.
So what made you decide to go into the medical field?
It all started really when I was in college. I like science, and so I couldn't decide exactly what science I wanted to go into, so I stayed broad and got a degree in biology. And my first job outside of graduating was in a hospital. So I was working at the University of Iowa hospitals in the Midwest, doing infertility work. So it was really rewarding, but I knew at that point I'm pretty much tapped out as far as I can go in this career. And my youngest brother, was in med school at the time, and he's a doctor now, obviously. And that's when I kind of started thinking about, okay, I love the hospital environment. I do laboratory stuff, but kind of what's the next step? And so then I kind of started thinking more about medicine, but then by that time I was in my late 20s and not really as interested to go back to school, especially med school. But I was still thinking about it at that time. And then there was an incident that happened where we had to take my daughter to the emergency room. And it was actually here in Albany. And she had bitten through the bottom of her lip after she had fallen. So we went to the emergency room, my wife and I, and it was a gentleman, he was a PA. And I didn't think much of it, but he did an amazing job of keeping her calm. He had to inject lidocaine into her lip. She didn't even know it happened. Stitched her up, and she was happy as could be. So it was at that moment I pulled him aside and said, "What is a PA? What do you do? I know what you do, but..." Then he told me about the PA, the physician assistant profession, and what he did, his military background, kind of how he came to the point where he is now. And that was the moment I thought, okay, this is what I'm going to do. I'm going to be a PA.
So tell me a little bit about the schooling. Like, what do you have to do in order to become a PA?
Yeah, so it's very intense, but it should be. I mean, it is medicine. You have to have a degree in something, and usually it's a science-related degree. So mine in biology was great, and with my background of infertility, it actually kind of helped their statistics because they'd never had anybody come from infertility and lab side of you to be in their program. But I had to complete all my prerequisites, make sure everything was up to date for my undergraduate degree. And then I applied in Albany, and it was really the only option I had. Because of having a family, I really couldn't go anywhere else. So thankfully, I got in first try. So the first part of the PA school is the didactic phase, the teaching phase. And so it's med school squished into 1 year. And so it's extremely intense, it's really hard, but it's really rewarding. The second year, that is when you do all your clinical phases. And so pediatrics, internal medicine, family practice, cardiology, endocrinology, that's when you do what you want to do. There are certain core things you have to do, and then you can decide on the electives that you want to do. So at that time, it was a 24-month program, and it was a certificate. But now all the programs are masters.
I was going to ask you if you had any advice for someone who's interested in going into the medical field.
What they need to do if they're interested in this is when they start investigating the PA programs, they all have open houses. And so you want to go to their open house and see what is it they need from you so that you can actually apply and have an opportunity to go to their school. So you'll find out the prerequisites, you'll find out about their program, and the open houses are very informative. I went to Albany Meds, I went to Quinnipiac, and I went to Stony Brook. And so it just gives you a wealth of information on what you need to do. A good option to do too is shadowing. So we do have sometimes some high school students will come here and they'll shadow one of us for a day and they can see what we do. And they can shadow a nurse, you can shadow a doctor, you can shadow one of us PAs. And it just gives you a feel as far as what we do each day, and do you actually like this?
So, what personality traits do you think a good PA should have?
Definitely, there's a lot of them. Good listener, because you spend your whole day listening to people complain. And I don't mean that in a bad way, but you're trying to fix everybody's problems. And here, it's health-related problems, so you need to listen to what they're saying to you. You need to have empathy, you need to be sympathetic, you need to make them feel like you're glad to see them. And you need to take the time to listen to their stories. You want to try to make a difference so that they feel better leaving than when they got here.
Would you say it was easy for you to find a job in this career field?
Yeah, it's really easy to get a job. And what's good about the PA profession is you can work any profession as far as any specialty, whether it's ENT, pulmonary, cardiology, gastroenterology. Me personally, I like family practice.